Good day. So today, I will be making a video demonstration on how to do a posterior lower leg splint with a stirrup using some of the original materials and some DIY materials. So watch until the end for you to be able to learn on how to do this procedure. Just a heads up, I made this video without any assistance, but if ever you have any company, please ask for their assistance. To start, it's better to introduce yourself first before starting the procedure. Maayong hapon sir, ako si Joe Marie, gikan ko CIM, usa ko ka clerk dere. Nya asa di ay dapit ang na-fracture o ang nabali. Before you prepare the materials, tell them and explain also what will you be doing. So for this procedure, you will need a pair of scissors, bandages, splint, better if it's prepared by yourself, not just a pre-cut splint, and some DIY materials if you don't have any of these. For example, an extra splint and Stockinette. Don't forget to wash your hands before doing the procedure. Start by telling the patient to lie down in the bed in supine position. Make sure that he or she is comfortable. You then put or place pillows under the thigh of the affected lower limb of the patient to elevate it for easy placing of bandage and other materials later on. You also make sure that the angle of your foot and the leg is 90 degrees and should be in neutral position. If you don't have any pre-cut splint, you first measure the length of the splint that you will be using. This is through measuring 2 finger breadths just distal to the popliteal fossa, passing the toes, making an excess of at least 4 inches. After which, you can now cut the length of the splint. And for this procedure, since it is already a pre-cut splint, all you need is water. This is to soak the splint. Do this for the 2 splints, the L-shaped and the U-shaped one. Dry them out using paper towels or tissues, or you can just wring them out. Before placing the splints, make sure you place a stockinette to avoid damaging the skin as well as keeping the limb clean. You can now place the first splint under the leg up to the foot, making an L-shaped splint and bending the excess splint towards the foot. You then apply the other splint, covering the lateral and medial portion of the leg, and make sure that it is placed under the heel and secure it. To secure the splint, bandages are wrapped around the lower limb. First, on the leg, just up to the ankle of the affected lower limb of the patient. Make sure you only roll the bandage snugly but not tight. This is to avoid discomfort and also to avoid blocking the blood flow. Before applying the second bandage on the foot, make sure that you uncover the toes of the patient for easy checking of the capillary refill time and also for comfort. You can now apply the bandage on the foot through figure of 8 wrapping technique. The last bandage should cover all the bandaged portion to make sure that the splint is secured. And to ensure that it is secured, you look for any rough edges by palpating the splinted limb, and you're done. Thank you for watching. I am hoping that you have learned something. Have a good day.